Let's have a look at the basic mobilization and soft tissue technique to the shoulder region. First, our movements. We have flexion, or we call it as well elevation. We have extension. We have abduction. If I hold him like this, now this is pure glenohumeral abduction. I can bring the arm up like this, so I'm ending in elevation. This abduction is made of glenohumeral abduction, and from here on the shoulder blade moves anthoracic, the rib, the scapulothoracic joint. Then we have adduction, abduction, and we have external rotation, internal rotation. And we talk about the combinatory movement called circumduction, like this. Now let's start. If we have a quite stiff joint here, maybe after fracture, I'm using traction technique. My hand makes this fork. I come up here. I push in the direction of my thumb. While I'm holding, pushing a little bit, I'm holding here on the elbow, in the supracondylar region, and the hand is here, squeezed with my arm to my chest. So I grasping with my arm as well, and now I pull. This is caudal movement. That means I'm pulling the head of the humerus down. So I'm opening the joint, I'm stretching the joint capsule. In the same position, I can direct my force like this, so away from the joint. I will pull the head out of the socket from the joint. This is a lateral traction, which I can do static, or I mobilize. This mobilization can be very soft, tiny soft, as a pain-reducing movement. If it is stiffness, I have to apply more a moderate pressure, or even going until to the end. I take off the slack from the tissue and I mobilize on the end. These movements, they have different intensities. Another helpful movement is I hold the arm like this. I go near to the joint line, which is here, and I give a pressure, anterior, posterior pressure. I'm moving the joint, it's joint play. I'm moving it backwards. To be able to do flexion, the joint has to be able to glide backwards. I can do it even up here. Once up here, I can do some traction as well to the outer side. If I have very painful joint, I put it into a nearly pain-free position, and I can use the double thumb technique, and I'm pushing anterior posteriorly. While mobilizing into flexion, I'm holding here the scapular bone. Otherwise, I have too much movement between scapula and the chest. So I'm holding it, and now I'm bringing up. So I can do the stretching into flexion. If I wouldn't fix here the scapula, it just would go up like this. So I'm holding it here. We always can use these shaking movements to relax the shoulder region. If we have a very tight situation here, I can massage here pectoral muscles. Very often we see the patient pulls the shoulder forward, is in hypertone here. So I just below the clavicle bone, I go in and I work on this pectoral muscle. I can work on the trapezius muscle. It's this muscular package on the top of the shoulder. If you have hypertension here, it's easy to massage like this. On the delta part, the outside part, or on the back and the triceps part. Okay.